In this video, we're going to discuss a couple of bone markings. So in human anatomy, if we look on the surface of bones, we see projections, we see depressions, we see openings, and those are considered bone markings. And these markings have lots of different names. Understanding what those names mean can make it a little bit easier to learn all those features of individual bones. So we're going to show a couple of examples, but you can always refer more to your textbook in understanding some of the rest of the bone markings. So we're going to start with kind of a prominent rounded projection, which is known as the head. So what we have here is a humerus, which is a bone in the arm. And if you look at its proximal epiphysis, we can kind of see this rounded projection, right? And something like this will be called the head. We see it in the humerus. We're also going to see it in the femur. Okay. The next structure I'd like to look at is something that we're going to call a process. And that's also a prominence type of marking, right? So it's going to project off the surface. So if we look at the vertebrae, we have a lot of processes in the vertebrae, like the transverse process here and the transverse process on the other vertebrae that we have. A lot of bones are also going to have holes or depressions on the surface. So we're going to show one depression as an example. So this is the scapula. This is the anterior side of the scapula. And the anterior side has this major depression, which is called the subscapular fossa. And the subscapular fossa is important because that's where the subscapular muscle is located. We can also have holes. And we've talked about the transverse foramen in the cervical vertebrae. So that's one example. We have the foramen magnum, which is part of the occipital bone in the skull. We have a lot of openings in the skull as well. And then the other example that I have here is the obturator foramen, which is an opening, a hole in the os coxa. Another projection that we often see on the surface of bones gets the name of the crest. So we have the os coxa, which is formed of 3 individual bones. The superior bone of os coxa is called os ilium, and if we look on its superior surface, this is known as the iliac crest, right? So again, it is a projection that we see on the surface of a bone. Sometimes we can also see kind of a sharp process. We're going to go back to the scapula. So right here we have the spine of the scapula. Again, a pretty big projections of the surface of it. By the way, here is another example of a process known as the acromion process. And an example of a fossa. This is the glenoid fossa or glenoid cavity. So this is actually where the humerus comes together with the scapula and creates the shoulder joint. We can have a projection that's kind of rough on the surface, and then it is called a tuberosity. So again, coming back to the os coxa, so this is the superior part, that's os ilium. This is the pubic bone, which is anterior, and then this is ischium, which is on the posterior and inferior side. Or on the surface of os ischium, we have a rough surface, and this one is known as the ischial tuberosity. We can also have a projection on the surface of a bone that kind of looks like, or has the shape of a hammerhead, and we have the fibula right here. So this is the inferior part of the fibula, and we have a name for this projection that looks like a hammer called malleolus. And if you think about your ankle, you have a medial and a lateral malleolus, and this one happens to be the lateral one, right? So because the fibula is on the lateral side of the leg. And the last structure that I want to pay attention to is something that we call a facet. And a facet is usually a flat surface So we see flat surfaces like this on the transverse processes of the thoracic vertebrae, and we're also seeing them on the body of the vertebra, and that's where the rib comes and articulates with the thoracic vertebra. So we've looked over some of the bone markings, some are projections, some are depressions, some are actual holes in bones, and understanding which one is which can help us understand some of those features on individual bones.